Today, we'll discuss transoral odontoid osteotomy, a specialized surgical technique for addressing complex conditions at the craniovertebral junction. This procedure is both challenging and essential for managing specific pathologies that lead to spinal cord compression. Let's begin with the key indications for this surgery. Transoral odontoid osteotomy is indicated for irreducible atlantoaxial dislocations. These dislocations occur when the odontoid process, or DENS, of the second cervical vertebra compresses the spinal cord. Common causes include rheumatoid arthritis, where inflammation destabilizes the atlantoaxial joint; congenital anomalies, such as basilar invagination or Klippel-Feil syndrome, causing malformations that obstruct the spinal canal; trauma, especially fractures of the odontoid that fail to heal properly, resulting in chronic misalignment; and tumors or infections like tuberculosis, leading to structural instability and spinal cord compression. When non-surgical methods, like traction, fail to reduce these dislocations, or when there is persistent spinal cord compression, surgery is the definitive option. Before surgery, a detailed workup is essential. This includes high-resolution CT and MRI scans to assess the bony anatomy, spinal cord compression, and adjacent soft tissue structures; dynamic radiographs to evaluate mobility and irreducibility of the dislocation; and neurological evaluation to determine the severity of spinal cord compression. Patients are often optimized preoperatively with anti-inflammatory medications or antibiotics in cases of infection. Stabilization devices, such as halo vests, may also be used to maintain alignment. The transoral approach provides direct, unobstructed access to the odontoid process through the patient's mouth. The patient is placed supine on the operating table with the neck slightly extended. This ensures adequate exposure of the oral cavity. Intraoperative fluoroscopy or navigation systems are crucial for precision. Neuromonitoring is also employed to track spinal cord function throughout the procedure. The surgeon makes an incision in the posterior pharyngeal wall, exposing the anterior surface of the upper cervical spine. Care is taken to avoid damage to surrounding structures like the soft palate and vascular tissues. Using a high-speed burr, the odontoid process is carefully drilled and removed. The surgeon works meticulously to decompress the spinal cord while avoiding injury to adjacent tissues, particularly the dura mater. Any inflamed or abnormal tissues compressing the spinal cord are excised. Once the decompression is complete, the surgical site is irrigated and the pharyngeal incision is closed in layers. Antibiotics are often administered to reduce the risk of postoperative infection. Following the osteotomy, patients typically undergo a posterior stabilization procedure to ensure spinal stability. This is usually performed as a second-stage surgery, involving techniques like occipito-cervical fusion. Postoperative monitoring focuses on assessing neurological recovery, watching for complications such as cerebrospinal fluid leaks, dysphagia, or infection, and managing pain and inflammation. While this procedure is effective in relieving spinal cord compression, it carries risks including infection, delayed healing of the pharyngeal wall, or instability, requiring additional interventions. Nonetheless, with proper planning and execution, the majority of patients experience significant neurological improvement and enhanced quality of life. Transoral odontoid osteotomy is a critical technique for managing irreducible atlantoaxial dislocations. While technically demanding, it offers a direct and effective solution for decompressing the spinal cord. Careful patient selection, meticulous surgical technique, and robust postoperative care are essential to achieve the best outcomes.